order. And Amy is going to call the roll.
Allen Ginsberg, Andrew Held, Carla Poole,
Present. That's a different one.
Corey Tello, Hannah Eisner,
Here.
Judy Buchanan,
Here.
Richard Janetti,
Present.
Robert Cole. Okay, there he is.
Yeah, he's here.
Robert Colhase,
Present.
Scott Hume,
Here.
Sonia Reese,
Here.
Susan Schaefer.
Here.
And Corey Tello just joined us.
Okay,
Is there any public participation?
no public participation.
Yes. All right. So we have a fairly long agenda, so we'll move right along. We received the minutes from our regular session on October 14th.
Move approval.
Second, Judy. Is that right? Okay. Let's just call roll for this.
Oh.
Did I put Andrew? Oh, there it is.
Andrew Held,
Andrew, every time we have a vote, we have to do a roll call.
so you have,
So you have to
aye.
say aye or no. You have to unmute first and then say aye or no.
There we go. Aye.
Thank you. Sorry, this is so complicated. Sorry, go ahead.
Carla Poole,
Aye.
Corey Tello,
Hi. Hi, Andrew.
Hannah Eisner,
Yes.
Judy Buchanan,
Yes.
Richard Janetti,
Yes.
Robert Colhase,
Aye.
Scott Hume,
Here.
Sonia Reese,
Aye.
Susan Schaefer.
Yes.
Motion carries. Where you think you're going? The next item on our agenda is the consent agenda with bills to be paid. Do I hear a motion?
I'll move. Second.
Thank you.
Corey Tello, second.
Thank you, Corey. Okay. Oh, where?
This microphone is crap though, you could probably shout. So, Andrew Held,
Aye.
Carla Poole,
Aye.
Corey Tello,
Aye.
Hannah Eisner,
Yes.
Judy Buchanan,
Aye.
Richard Janetti,
Yes.
Robert Colhase,
Aye.
Scott Hume,
Yes.
Sonia Reese. Sonia Reese,
Aye. Aye.
Susan Schaefer.
Yes.
Motion carries. Thank you so much, Amy. You can sit down for a while now. I'm very proud to, with a lot of pleasure, my mouth isn't gonna work. I want to introduce Andrew Held. He's our newest member. And Andrew, if you could give us a short introduction. Just tell us whatever you want to tell us about yourself. And then after he gets done, we'll go around the Brady Bunch screen. I'll call out names. If you could just introduce yourself briefly, because of the length of our agenda. So go ahead, Andrew. You should, yeah, go ahead.
Yeah, so I've lived in West Bloomington now for about 20 years. I've been a youth pastor in the community for about 12 years now. I'm married, have one biological daughter, and we adopted 2 boys from doing youth ministry. Right now we're Youth for Christ, and it's City Life Bloomington, and we partner enthusiastically with our police department, our school resource officers, our high school, and just a holistic ministry that goes from, of course, there's a spiritual side, but just basic health and safety, civic education, lots of things. So the idea is to really connect loving adults to lost teens who feel like they don't have a place to go. So a lot of our ministry is done here on the west side, a lot with our more at-risk teens. We spent some time in the behavioral classrooms at BHS as well. So yeah, just excited to be here and wanting to listen and learn from you for a little bit, and forward to just our county forward.
Great. Well, thank you so much for agreeing to be on the board. So I'm going to include health department people so he can get to know who you are. So Kathy, CA, could you just briefly introduce yourself? Maybe.
Hi. Oh, yeah, I'm gonna put my video on there. Andrew, there we go. Andrew, I'm Kathy Culverston Anderson. I'm the Assistant Administrator at McLean County Health Department and a nurse, and would like to welcome you. I'm active in the Emergency Preparedness Program in particular, so we've been very busy with COVID and preparing for mass vaccinations. So I also work a lot with the Community Health Needs Assessment and our improvement plan. And that's, we are very active on the west side as well.
Thank you, Kathy.
Mhm.
Kim and Tom, one at a time, please. Tammy Brooks, you're next.
Hi, I'm Kimmy Anderson. I'm the Director of Maternal and Child Health Services with the Health Department. So we oversee the WIC program, family case management, and HealthWorks, which is a medical case management program for children who are in the care of DCFS. And then also AOK Network, which is a network that brings together any provider, educator, doctor that touches the life of a child between birth and 5 years old. The goal is to get them kindergarten ready so that once they go to kindergarten, they are ready to learn.
Thank you. Tom?
Good evening, Andrew. I'm Tom Anderson. I'm Director of Environmental Health. Environmental Health pretty much oversees its routine programs, food safety throughout all of McLean County, rural wastewater treatment, water well supplies of different sorts, nuisance complaints. That pretty much sums up geothermal technology. You're familiar with that. And somehow we inherited in early this year investigation of COVID-19 complaints.
And you're doing an excellent job. Tammy Brooks?
Hi there. I'm the Division Director for Clinic Health Services, which includes immunizations, the dental clinic, community health services like HIV testing and education, STI testing, TB, and also involved in contact tracing.
Thank you. Judy? You're next.
Welcome, Andrew. I'm actually serving my second term as a Board of Health member, and it's been a wonderfully rewarding experience. My background is in healthcare management and legislative work, and so I've been able to bring some of those and continue to learn here at the Health Department.
Thank you. And she's also a past board president. Mr.
But don't let
Spanos.
that me.
No, we appreciate you. Mr. Spanos.
Hello, Andrew. I thought I was logging on to the ISU Alumni Association. I didn't know what's going on here in the health department. Just a little joke, apparently not very funny.
So we're laughing.
First
Drew was laughing.
always laughing on the inside. I'm the first assistant state's attorney, and I'm here as the parliamentarian and occasionally to keep, I suppose, offer some legal guidance. Nice to meet you, and look forward to getting to know you over the years. Thanks.
Amy Hancock.
Hello, I am the Behavioral Health Program Manager at the Health Department. And so Behavioral Health Program does not provide direct services, but we do a lot of collaboration within the different programs in the Health Department. and also within the community, and also with funding. So there will be a lot of discussion tonight in funding. And just very quickly, my background, I have a master's in human services, and I worked in the Department of Corrections for about 14 years in the substance abuse field, and no more direct services after that. And so I'm really enjoying not doing direct services and doing more of the collaboration piece.
Thank you, Amy. Member Schaefer.
Thank you, Madam President. I'm Susan Schaefer, and I'm on the county board. I've been on the county board for 10 years. I'm also the chair of the health committee. So that means I'm the liaison between the county board and the Board of Health. And I'm pretty into mental health. You've probably seen my name before. And I think you were at CJCC one time to give a presentation. And I think that was the first time I heard about your ministry. So welcome. I think that you'll have some good input for us.
Dr. Hume.
Andrew, my name is Scott Hume. I've been on the board for about 3 years now. I practiced dentistry in Bloomington, Illinois, I guess. I've been living in the community since I was probably in second grade. So I've lived here. Kmart was a big store in town. Look forward to working with you and hearing your side of this, opinion on things and things like that. So nice to meet you.
Member Eisner.
Hi there, Andrew. Welcome to the board. I think I've been on the board this is my second term. I came from the other side, as it were. I was in the county administrator's office before I retired. And so I have to remember which hat I'm wearing sometimes as I sit as now a board member. So welcome you. Look forward to your valuable input and ready to put you to work.
Member Tello.
Hi, Andrew. Very happy that you have joined us. I have been on the board probably the longest of anybody. I've been on for decades. It's kind of, I just feel like there's still lots to be done. And you will find, as you already have probably, that there are so many diverse departments, and it takes you a long time to learn about each one of them. And each one of them is just absolutely essential to our community, and very proud of all of them. My particular passion, though, is probably behavioral health, because my career was, I was a school psychologist and then a special ed administrator in both Unit 5 school district and District 87 for my career, and also worked briefly as a therapist at the Center for Human Services way early on. So so I think you and I share that, our passion for youth and making sure that we support them in every way we possibly can. And I guess that's it. I also am on the Baby Fold board, and I just have, since my retirement, I have spent, I try to do as much as I can to get the community to be able to thrive, and again, think this is an amazing community, but we still have many things that we can work on. And I want to say, Susan Schaefer undersold herself, because she was very instrumental in the McLean County Mental Health Action Plan. And that's what, we've all been carving away at ever since that was developed in 2015, trying to bring that to full implementation.
Member Reese.
Yes, thank you. Andrew, nice to meet you here. Look forward to knowing more about you and your life and your role in community. I am recently retired from Advocate Broman, and my work there was primarily with regulatory affairs with the state. And I have continued that. I formed a little consulting company, so I continue to work with Advocate even after I've officially left them. And you don't ever really leave those things. I also serve on the United Way board, and you'll see United Way mentioned in the packet tonight about a role that they have played with helping provide food for the community. So there's a number of things we do there. I am the representative to the Behavioral Health Coordinating Council that provides direction and advice for that side of things. So those are some of the things that I do when I'm not busy being just interested in other community activities here.
Thank you.
You're welcome.
Dr. Giannetti?
Yes, I'm Rich Giannetti. I'm a family physician by training. I work for OSF. I spend my time, about 40% time clinical and 60% time administratively in charge of the ambulatory offices in the community. Also teach at med student SIU School of Medicine. Enjoy medicine and help you guys help the community's health issues with some legitimate medical advice, because as been noted, we've got a very diverse group here, and also I'm new to the board, so the Board of Health does a lot of diverse things that I really wasn't aware of, so I got on it. So it's been interesting, and I'm glad to be a part of it.
Thank you. Member Colhase?
Welcome, Andrew. Bob Colhase. I'm with Farnsworth Group Engineers, and a lot of my specialty would be related into environmental health. But I've enjoyed tremendous amount learning about all the different services the health department provides. And I think you're going to enjoy learning how incredible and dedicated all the staff are. So welcome.
And before I get to the room, I'm Carla Bowl. I'm your board chairman for a little bit, I guess. I've been on the board about 4 years or so. Been in the community. This is my 9th year in the community. My husband was active duty military. And so my children are starting to circle up in Illinois for no reason other than that's where they're coming from. I'm a nurse, I'm a midwife, and I've got a real passion for, I've either been a public health nurse or been a maternal child.
Amy, do you want to go?
That's okay, that's how we before, but you're gonna have to stand up.
I'm Amy Brooke, and I read the role there. I've been with Health Department a couple of years and with the county since 2007. I do a lot of different things at the Health Department, some vital records, some HR stuff, and right now I'm on the public information team for COVID.
Go ahead. Jessica, she got the lady's not on you, right?
I have no.
You don't see. Go ahead.
Hi, my name is Samantha Vasquez. I'm also an attorney. I work closely with Chris Spanos. I'm an assistant state's attorney, so the two of us serve as your parliamentarian for the meetings, and if there's any legal problems or questions, we can help with that too.
Thank you. And last but certainly not least.
Hi, Andrew. Good evening. So I'm Jessica McKnight, the administrator of the Health Department. So welcome. We're really happy to have you on board.
All right, so you've met the crew. You'll get to know us all. Hopefully sometime in the not too distant future, we'll actually be able to have in-person meetings so you can get a better flavor of the board. And our next, we're gonna have to skip an agenda item because I don't see the wellness person on the.
Yes, yes.
Oh, you're here. I'm sorry, go ahead.
I'm the health department on the screen.
Okay.
My name is Terry Payne, and I'm a health promotion specialist for the health department. And one of the best parts of my job is I get to manage the county employee wellness program, and I've been doing that since 2015. We engage employees in activities and programs that support their adopting healthier lifestyles, and our goal is to create a more vibrant workforce and also reduce medical costs. So what we are wanting to do is some behavior change campaigns. There's a handout. It would require working with WellSteps. They create a wellness platform that will help us manage the behavior change campaigns. And we have 3 that we would like to offer to our employees next year. One is for stress to help them adopt effective strategies to cope with stress. Another one is focused on vegetables, helping and encouraging them in purchasing, preparing, and eating more fresh vegetables. And the last one would be a physical activity campaign. The benefits to us working with WellSteps is that they will provide a lot of the marketing materials. They'll have the wellness platform, like I said, that the employees can access through their computer, their laptop computer, their tablet, or their phone. And there's fun, interactive screens to help them track their progress, videos and articles to help motivate and support them, cues and reminders and tips. And when we do the physical activity one, the best advantage will be that they will be able to sync their devices, so that will simplify their participation. And I think we'll get a lot more people to participate if they don't have to worry about remembering to go back and write down how active they've been. We'll automatically just be recording that for them. And the other advantage to using this is it allows me to offer team challenges, and those, frankly, are the ones that employees enjoy the most. There are leaderboards so the teams can compete, and I think it just kind of helps bring everybody together when we have a team challenge. They also provide for me what is really important, and that is numbers and reports on outcomes and participation. So, like I said, I did provide a handout that kind of gives this overview and a little more detail about the challenges. And so if anyone has any questions, I'd be happy to try to answer those.
And member Buchanan, go ahead.
And thank you for the handouts and for your comments. Is this a vendor that we've used before, or is this going to be a new opportunity?
Actually, we have used them, but not in the last 6 or 7 years. We had a wellness platform that we were using that no longer exists. For the last 6 years, we've been using it. So before things went online and where we were still doing things with flyers and more paper focused challenges, this company was one we worked with back then. So this will be the first time we will be working with them with a wellness platform.
Well,
knowledge.
Particularly with what's going on and the staff, being called upon to perform above and beyond, seems like a good time to, provide this. And I like the technology aspects of it too. So thank you.
Member Tello.
Yes. I believe last month we said we were going to revisit this because there were some concerns about having to give personal identification in order to be a participant. So did we work that through? Having to be part of the program, you had to give a lot of personal information to be entered into the program and participate in the activities and the challenges. And so I just wanted to, I just wondered how that ended up.
That actually, information will be very limited. The only information that they will be receiving will be the email, the county email, for the employees that choose to register and participate. And that's the only information they'll receive. And as Judy said, I think the other advantage to having this wellness platform and the easy accessibility for employees is we really, this last year, due to COVID, it kind of gave us an extra push, been really trying to create programs that employees can do anywhere, anytime. And that's what this will allow us to do. And we should be able to engage a lot more employees with this.
Member Eisner, go ahead.
Thanks. And Corey, thanks for bringing that up because I think it was a question that I raised. So just to be clear, in the agreement we had in the packet last month, it did indicate that the county would be providing phone numbers and birth dates, et cetera. So Terry, are you saying the contract or the agreement's been changed now to only provide the employee's county email?
The contract can be changed with that wording. What they suggested was that if we had an attorney that wanted to modify the contract in whatever way we felt represented more what we felt comfortable with, that they would be willing to take that.
Okay,
That
thank you.
might
'Cause-
be faster, than us, than
I
them
just-
trying to guess at what we want.
Okay. I mean, I just didn't think that the county should be providing that information. Certainly if somebody wants to use the platform and they request additional information from that individual, then that person's free to do what they will in terms of providing step, I think, with their own personal information. My concern was only that the county would be providing that from our records.
Yes, Member Reese.
I was looking at the what you've displayed for us, and computer and iPad and cell phone. But today there are so many people that wear all their information on their wrist. So is this program going to also back up to all of the Apple Watches or whatever people are wearing today?
Yes, it does allow them to sync to their fitness devices.
Right, all of them.
Yeah.
But thank you.
Member Schaefer.
Are you done, Sonia? Okay. I want to go back to what Hannah said, and I guess maybe ask Samantha if that contract had been looked at, because I know that at the last meeting she was there. So I guess that's my question. Oh, so we get Jessica today. Okay.
So Terry, we've been working on getting an updated statement of work. So I need to still get that to legal now that we've updated it to be for the full fiscal year 21. So we can make those changes and even suggest those changes be made that Hannah has brought up.
And this will be an action item on the December agenda. Because the contract's not ready yet. And Andrew, just to kind of fill you in, this is a county-wide wellness program that we just had some concerns about, and that's why we invited her to come and talk to us. Are there any other questions while she's here? Okay, thank you so much. We appreciate your time.
Thank you, Terry.
Thank you, Terry.
Yeah, thank you all very much. I appreciate the opportunity.
Have a happy Thanksgiving. Dr. Ginsburg, we have a new board member, Andrew Held, and if you could just introduce yourself for him, just introduce yourself briefly.
All right, I'm Alan Ginsburg. I am a pulmonologist intensivist in town, and I've been on the board for the last 6.5 years or so. And I currently am late because I'm in the middle of COVIDville.
Yeah, we can imagine. It's got to be pretty hard for you these days. Thanks, Dr. Ginsburg.
Yeah, not easy.
Yeah. I wish I could say something that would make it better, but I don't have anything. Behavioral Health Coordinating Council, Member Reese. Unmute yourself.
Well, this time I'm going to be accurate. We really haven't met since the last meeting, and the next meeting will be in December. But I do want to tell you that the planning is underway, and notices are going to be going out about the Behavioral Health Forum. That process is going to take place over a number of months. Some of you may recall that we did that in the past few years in a day session, and people came for a whole day to like the Marriott or whatever, and went through programming and had to choose with programs. This time there's going to be something offered about every month or more often, and it will be virtual. Hello, that's what we're doing today. So you will need to register to be a part of it. But the sessions, first session will be from 12 to 1:15 or something like that. So it's going to be over a lunch hour time. So you should all be getting some invitations to this if you have not already, and be looking at putting that on your calendar. It's just a really good use of time. And this first program is going to address issues of behavioral health and link some of that to questions of racism. So I think it's very timely to bring that together. So that's what's happening.
Great, thank you.
You're welcome.
Most of you, if you didn't receive a, I think Tricia sent out an email today. If you didn't receive it and you want to receive it, let me know because I can forward it to you. Okay, Mental Health Advisory Board. Oh, there you are, Corey.
Yeah, here I am. Hi. Hi. Okay, I'll try to be brief because we've covered a lot of ground since I've shared with you. We have met the Mental Health Advisory Board. We have not met, I don't believe, but a subcommittee of it has met, which is the marketing subcommittee. And the marketing is to market 211, the call line through PATH, to the community to really expand and enhance that marketing, because we know that the first 3 months of 2021 are going to be brutal. And for many people in terms of stress and anxiety and depression and addictive behaviors, et cetera. So we want to make sure that people who are having need for additional behavioral health support, they know how to get help quickly. And and 211 is the number to call to get that. And we want to make sure everybody in our county knows that. So to that end, this marketing committee we're putting together this plan that I'm going to share with you, and Judy's going to talk about part of it. But the goals of doing this marketing plan are to raise consciousness of McLean County citizens about the 211 helpline and the crisis line, because that's also who you call if you are in crisis. We're also trying to reduce stigma for seeking behavioral health support, especially for populations that have historically not used it, and also for populations who have been most negatively impacted by COVID and social injustice. We also want to create a countywide network of contact point people in just about every organization, entity, business, et cetera, so we can give information to them to help us promote the use of 211. And so ultimately we want to just increase the use of 211, including they're just now rolling out a texting line. So, and they anticipate, obviously that's going to appeal to younger of our county citizens. So, so to that end, we have about 4 parts to this. And we started by looking at the capacity of PATH. If we really do market this so, aggressively, is PATH going to be able to pick up all those calls if we really do get an increase? And so we've had many conversations with Karen Zangerly at PATH, and she has talked with her staff. And again, then we've talked with other community entities, including our own a group just the other day that, is part of the Community Health Improvement Plan. And at this point, PATH believes that if they can get a few more volunteers trained, which they plan to do, and they think that that is more likely now, because now that they have they've rearranged their remote lines, people can actually volunteer as taking PATH calls from their own home now. So we're thinking that may increase people's willingness to volunteer. So anyway, Karen has assured us that we can go ahead with this plan, but we also need to help get the word out that volunteers would be very welcome. And of course, they go through a rigorous training program so they can meet the needs of the callers. So that was the first thing. We just wanted to make sure we were solid with asking PATH to pick this up. And then the next thing we talked about were all of the marketing tools that we might use to get the word out. And Judy's going to talk about that. So, so I'm going to now pivot away from the 211 marketing campaign and talk about some other things that we want that this whole mental health advisory board and the marketing subcommittee want to promote. And that is mental health first aid and mental health first aid training for youth. I'm guessing just about all of you know what that is because we've supported it, funded it, and talked about it several times. But again, we know that that is a program that it's an evidence-based day-long training for anyone that wishes to just know how to support someone who might be having a mental health issue or concern. It gives people tons of information about different types of mental health problems, behavior and substance use problems, I believe, to some degree, and then what kinds of supports can be offered and how to help people get help. So we have learned that some of the trainers that have been doing that are no longer training. So we have learned that we need to bring a trainer of trainers training to our community so we can get some more people trained to deliver the course. And so, and that is quite costly. And so one of the things we looked at is we would like to use some of the money that we've already put into our fund balance to help pay for half of the cost of that. And then we also want to be able to help pay for some of the supplies that the trainers need when they do the courses. And then also we would pay for part of the cost for the participants, the fee they pay to take the course, because the company that oversees all this has raised the price. And they also now offer, and part of why we need to relook at it also is because the training, like everything else, can now be delivered remotely or in hybrid fashion. So we want to make sure that the people who are trained to deliver the course can deliver it in all formats, either in person, hybrid, or remote, and that they also have all the materials they need to do it any way they need to do it, and that the participants can be, again, we can keep the cost to the participants at a reasonable fee. So, so in addition to marketing, mental health first aid, the other thing I want to talk about before I turn it over to Judy is something that we are also kind of kicking around and just want to bring to your awareness right now is the concept of kind of maybe using community liaisons and thinking about a pilot project where we would identify neighborhoods in our community that, again, have perhaps been the one that have been most negatively impacted by COVID and social injustice, and who have perhaps been reluctant to use behavioral health services. And we would identify peers or just, people who live and work in those neighborhoods, and have one person identified who would kind of be the contact person for that group. And they would help, just bring information about behavioral health. They would bring information about how to get support. They would help with reducing stigma. And they would be a group that we would, again, there would just be, we would start maybe with 3 or 4 in 3 or 4 neighborhoods, and those people would get some training, including mental health first aid, and they would get support if we did this from Amy Hancock and her colleagues in the behavioral health department. So it's something that we would like to explore further and flesh out. And it might be that once we know exactly what we would ask of them, what deliverables we would be asking of them, we would also put a small stipend for them in exchange for the deliverables. So, okay, so quickly then, thank you for bearing with me. And then I want to talk about again, or Judy's going to talk about the different things that we might be using to market 211.
Go ahead.
Thank you. Yes, I have a list. As Corey has said, this is a 211 marketing campaign, raise awareness, reduce stigma. So we're got an up arrow and a down arrow. And this really originated with our mental health advisory board as they were deliberating the various services that we're going to discuss later tonight about funding. You know, they reminded themselves and us that a lot of effort is made to providing services. Obviously, we don't ever seem to have enough, but a lot of effort and funds and time goes into provision of services. And they wanted to make sure and had some concerns that people may not really, take advantage of those services because they aren't aware of it, or they have, they're fearful that there's a stigma attached if they seek it out. So that's kind of, as we looked at a very well utilized and great history and success in our community, the 211 number with PATH. So we did start with PATH, and we raised with Karen, you know, if we ramp up the awareness campaign, are you going to be able to handle the volume of calls? And that's something that only time will tell. This is, we recognize it's going to be over many months that to see things, but it is important that people are somehow reminded that there is support. And this is going to be about support. We've talked to agencies, we know that many of them have waiting lists and aren't in a position, but so often just the person calling someone to talk with them will be helpful and perhaps direct them to services, or maybe just have heard them out at that particular time. You know, and one of the ways PATH has within their technology, they do track abandoned calls. So they know they know what their abandoned rate is now. And so as we continue to evaluate if this is creating too heavy a burden on them, in addition to our helping to recruit volunteers, they'll be looking at that abandon rate. One of the first places we're going to start is with the, there actually is a graphic that was created and has been being used. That was done by free of charge. Chestnut brought in their graphics people, Chestnut Health Systems, and developed that. They are very amenable and willing to work with us. Behavior Health Priority Action Team from our annual assessment, and talked about the actual language, because while we want to send this message out, we recognize in terms of the platforms I'm going to share with you that we hope to use, the message has to communicate in very, very brief way what it is that we hope people will take away. So we'll begin really very quickly. There's probably a gradual rollout of other pieces of this plan, but we will begin with looking at that message. We will be using billboards, and I know that we'll be working with health promotions and behavioral health and the folks at the health department who are into that, because they have, and it was in our packet tonight, they're a rollout of their media plan relative to COVID. So, we are aware of that, and they're two different campaigns, but both designed to provide people some relief and perhaps some information. And United Way and PATH had initiated an effort several months back to really promote 211. So many other things have come into their worlds that they are now spending a lot more time on. So we're going to pick up and probably continue some of, maybe not all three of the billboards they currently have under contract. We'll be using Constant Contact. Chestnut at this point sends out on a regular basis with the logo, the graphic initially, some very healthy help support type messages. And that's done electronically. And so they are also agreeable to allowing us to add to that list. So we can add our churches and some of our businesses and just expand the number of people who are seeing this message, that there is going to be someone who can listen to you at 211. We're going to be working with Connect Transit right now. United Way and Path had been advertising in the interior of the buses. We're hoping to be able to have some exterior signage. The back of the bus probably would be a very good spot. You're sitting at a stop sign and that bus is right ahead of you, as well as they are throughout the community on 7 days a week now. So that we'll be looking at that. In addition to that kind of signage, we're going to look at kind of picking up from political campaigns. Fairly recently, you would have all seen a number of yard signs throughout the community, as well as larger signs on heavily trafficked roads, and again, smaller signs in some of our smaller communities. So we're going to look at some yard signs, again, with that message, very brief, very quick, 211 support call, and try to get them into as many of our rural communities, because we really are a county effort here. Electronic newsletters, we have churches and others that routinely might have been doing a bulletin perhaps in the past or some kind of a program. Those kind of entities are now using electronic. We also will be looking at some media, print media, radio, hoping for some interviews, perhaps some advertising. That becomes very costly, but we will be looking at that as an opportunity. Again, if we can get some interviews followed up with some public service announcements, that's on our list. And then flyers, thousands of flyers, again, that are going to carry this message, to be put in, food bags, just all kinds of places in our community where boxes and bags and other things are being distributed at some of our community centers, our Boys and Girls Clubs, things that we can get into the hands of their members and their families. So that's sort of where we are. And as I looked over what we're doing in health promotions, I see that they're complementary, and it does give us another opportunity to send to the community the fact that there are places here that you can receive support. In addition, because initially it was just to look at raising awareness of behavioral health and reducing the stigma. Now, of course, we have the emergence of COVID and all the fear and distress that has created. So I think these two are complementary, and we hope to really get them up and going as early in 21 as we can. So if there are any questions, I'm open.
Thank you very much, ladies. Any questions?
Yeah, I got a couple questions. Just starting off early, I guess.
No, that's good.
So with like the signs and the billboards and all those information, are we going multilingual in those things? Are we reaching out to Hispanic communities? Is there Indian population and those? And then part two of that question was, I heard working with agencies, but is there a thought process to more maybe social media stuff geared towards youth? Because most youth aren't, if they don't know you or that relationship, they're not going to call a strange number. So how do we make it? There's a connection piece there somehow.
Very good. In fact, social media, it's a big piece of our campaign. Excuse me for just simply not mentioning that. And part of that social media campaign will be reaching out to other organizations, because we would like that message coming to you from someone who may look like you. So we will be in social media. We're looking at, advertising and things of that nature. But there are lots of social media within organizations, community centers, other entities in our community. So that's definitely a big piece of it. And we want it to be culturally sensitive to the extent we can. The flyers, for example, will have information in Spanish as well as English. I don't think we will be getting into a number, other languages, but Andrew, why don't you and I talk about how we could make that happen so it does have some more appeal to people of, with different cultural languages that they would appreciate seeing this message in.
We are continuing to seek input from anybody and everybody. So we would so love it if you would, if you got some real concrete ideas of different ways to do this. We really need that and want that. And we also have talked about trying to do some focus groups with the graphic, like get some entities to put the 211 message graphic in front of focus groups, and then have them tell us which ones, resonate the most to them, and which ones would be make it more likely and more appealing to use 211. So, and that really needs to be a very broad age, all different types of citizens. So we are working on that too before we roll it out. We want to make sure it's the messaging that really works. We may need to have, 2 or 3 ones that reach different pop ages or whatever.
Because there again, if the effort here is to try to really reach out and remind people that there is some help, they can call and have someone who will be a listener. If we're not communicating that in a way that resonates or that someone feels is okay, then we really have missed the mark. So we're sensitive to that.
Yeah, and if you would want to put it in front of some of your youth and have them give us input, that would be fabulous.
Mm-hmm. That's part of what we hope to do, is people that might have a support group show this and see what's their response.
Remember,
Yeah.
Reese?
I would even in your book group make sure to have youth, because you might get the twofer of just young people just knowing social media. They just know it. But if it's their own, then it's something that it brings in inclusive, that it might get used more. Because this is one of the hardest things that we struggle with the whole time I've been working with teens, and whether it's Black culture or Hispanic culture, of building that trust of even getting. So those are some barriers that are just tough to get around.
We will be in touch with you, Andrew. No, that's exactly what we need.
Be careful what you ask for.
I just said I know some of the barriers, not all the answers.
This is a work in progress, and it definitely is a team effort.
Member Reese, go ahead.
Yes. Just one more form of media that really is hitting the very younger people, and that's TikTok. And so if you haven't included that in your regimen of where you're going to put messages, I would suggest you do. It's a great media, and I have discovered it, and just because I have some friends that are doing some things on TikTok that are worth watching. So if y'all haven't gotten on it, program.
As I mentioned, social media, that, we're talking Facebook, we're talking others, including TikTok. And TikTok, and Andrew probably is aware of this, it seems to be very popular among the young
ones. Yeah. I'm occasionally a grandmother.
Member Eisner, go ahead.
Really fantastic work, ladies. Lots of wonderful ideas and good energy. I just want to be clear on how we move it from this forward. You talk about the we and the focus groups. Are we seeing this as something that is the baby of the Mental Health Advisory Board? Are we seeing this as something that would be taken over by Amy and her staff or health promotion staff? I just want to be clear, because sometimes we get tangled up in the process of rolling it out. So,
and thank you.
Have some idea of how we're going to do that.
Because I think you sense the excitement that both Corey and I have, and the passion for this project. But no, we're not both looking for day jobs to roll this out. but we would like to be a part of it. It did originate with our mental health advisory board. It now becomes a part of the health department. So we are planning on sitting down with Jessica first and then looking at behavioral health, health promotions. And in fact, right now, I know that there are several open positions in that area they are hoping to fill. So we expect within the next few months, we might have a fuller cadre of people in that area. But from my perspective, it becomes a health department project. Health department funds, in our budget are paying for it. And it's our initiative that had come at the suggestion and recommendation of the advisory group.
We also have, the marketing subcommittee may continue to play a role just in terms of being the, having that as a more singular focus if we want to do that, but that still has to be embedded back into, the layers of the health department and health promotion. And we also know the behavioral health priority action committee, which is part of the community health improvement plan. We spent a lot of time talking about this exact thing with them at their November meeting just the other day. And so I think we need to continue to involve them too, because they represent many, many different entities. And this fits right into the community health improvement plan goals and objectives. So, Susan reminded us that, this is part of the, behavioral health coordinating council as well, I think. And so, I think we need to really think about the integration of lots of things and yeah.
Some of it's already happening and the health department is represented on the various groups that Corey's just mentioned. But no, I think it goes back to our staff. Doesn't mean that some of us as board members or volunteers may not be involved. I would anticipate being engaged in some of this, but only working with staff and with their knowledge.
Member Reese.
Is it your impression that the PATH board is also immersed in this issue as well?
Well,
we're talking about PATH and they have a board of their own. So I want to make sure we're not stepping into their world.
Well, that's a good question, because that was one of the questions I asked David Taylor with United Way, because they started something like this because we want to make sure we weren't setting up something that was going to be parallel or duplicative. And he was delighted because they have some other things now that are a higher priority. And the same with PATH. I don't know to what extent Karen has had that discussion with her board, but I know she has discussed it at length with her staff, because we asked her the question, if we're doing this, if this gets done and it generates more calls, what are your, what's your capacity? So Karen, in fact, Corey and I have had several fairly lengthy Zoom calls with both David and Karen, and have tried to make sure that that as we were doing something, it wasn't going to be jeopardizing or in any way interrupting or seen as, a barrier to what they were doing.
If you will recall too, again, this is how so much of this, which I love, there is this coming together of so many things. And one of the things that we talked about with Karen is, you will remember that one of the pieces of the request for funding, 553 funding from PATH, was to add a supervisor, add a full-time supervisor, so that and part of that was to make sure that the new text line can be well supervised and supported. But I do believe too that it was Karen's thought that if that position would be funded, that would also give them some additional manpower that they need to do, what we're talking about as well. So I think, again, that person can, as any position does more than one thing. And so I think she felt like that position would also help with, supporting if new people had to be trained if they need more volunteers, they have to have somebody to supervise volunteers, et cetera. So that additional position that she's already asked for would be of help.
Anyone else? Thank you, Sonia. Anyone else? Okay, thank you. Guys have done a lot of work in a very short period of time. So thank you so much for doing that. County Board Member Schaefer.
Thank you. Last night, we passed the budget for 2021, and there were no issues with it other than we kind of made a little bit of an adjustment, but not for the health department. So the budget is done. Also, we had an election, and we're going to be having some new board members because there were a couple people that were not running again, or had stepped down, or had been primaried. So on December 7th is when the new board members get sworn in, and then the county board reorganizes. So committees may change. We will have the health committee will actually be held on November 30th. And so that would be still the existing members. Actually, the committees that full week are the existing members and the existing chairs and whatnot. And then once the reorg happens, there will be new people on the health committee. And so there'll be new people on other committees too. So we'll just have to wait and see what that brings us and who that will be. And Jessica can meet more board members that way. So and I'll be happy to answer any questions.
Any questions? All right. Hannah, do you want to wait until you present your action item, or do you want to discuss it now?
Nope, I'll be happy to wait. Thank you.
All right. Ms. McKnight, you're up.
All right, so you have my monthly report, starts on page 5. And this month, the program that's being highlighted is the behavioral health program. And I know Amy is here and has quite a bit of information in the packet for you. We also have statistics from September and October from our divisions in the packet. So Amy, I don't know if you want to start, if anyone has any questions for Amy about her report.
Yeah, Member Eisner.
Yeah, I do have a question. I don't know how you want to handle them or not, and it has more just to do with not your activities per se, Amy, but you talked about doing the kind of planning for the division, et cetera. And I just wanted to bring up, and I think it's something for us to consider. We've talked a little bit in the past about how your division works with what is, I'm going to call the county board mental health program, because that's how it appears in the budget. But the other programming that is taking place with the sales tax money, I'd like to sort of put our heads towards how we have a guarantee that we're working in unison within the county. I get the sense that we're kind of operating in two different spheres. And that may not be true, but maybe you can address whether there's some collaboration taking place. But and I think for our board and not so much for Amy, I think we really do need to think about that as we do mental health programming, and there's other programming taking place to make sure that we're all working together on it. Whether it's periodically checking in or taking notes, or how exactly. And I don't have any suggestions this evening, but that was the only comment question I had.
Yeah, sure. And I think Jessica can probably help me answer this too. So as far as the Behavioral Health Coordinating Council and the behavioral health at the county level, and then the behavioral health program at the health department, we do collaborate in different programs. I don't know if programs is the correct term, but for example, like the behavioral health, the forum that I sent the Board of Health members on the different webinars. That's a collaboration that we have done together, and of course other community members. And there's the trauma-informed care within the community. the BHCC is leading that, and the behavioral health program at the health department, we are joining in on that collaboration. And then of course the BHCC, Trisha Malai is one of the mental health advisory board ex officio members, and also on the marketing. So there is different collaboration in different pieces. And the triage center is actually scheduled, hopefully starting in December, to assist health department staff with emotional support. And so that's something that we have directly coordinated with the county's behavioral health program. So it's not necessarily like, especially at this point, it's not necessarily, just sitting down together individually, but it is different collaboration pieces on things that are happening. But I think, Hannah, you may even be asking more just about like programs or new program initiatives and making sure that some of that isn't duplicated, or that it kind of just goes together instead of being divided. But Jessica, I don't know if you wanted to add, I know pre-COVID, we've talked about having a discussion just between the county administrator, and because even with the Behavioral Health Coordinating Council, it's just such it's a very interesting dynamic as far as like the behavioral health program within the health department, and then the Behavioral Health Coordinating Council being its own thing. And so pre-COVID, there was a plan to have a discussion between all of us and kind of just outline some of those parameters and boundaries and come up with something. But unfortunately, during COVID, that hasn't happened because of everyone's capacity. However, like we still continue to have a collaborating, partnering relationship, but it will be extended, I'm sure, in more ways, especially post-pandemic.
Member Buchanan.
Yes, just an observation and a comment. And thank you, Amy, that you provided a lot of information to us. I was really glad to see in your trauma-informed report, one of the points that you're working on will be to increase people's knowledge and practice in cultural aspects. And, we've been reminded, particularly as a health department here in our community, of disparities and inequities. And probably one of a really good way to begin working on that is to make sure that we as a department, both staff and board, are much more knowledgeable and sensitive to that, because as we reach out to help others, we can reflect that. So I'm glad to see that, and encourage you just to really work it through.
Yes, definitely. And I don't know if it was included in this report, but it has been included in other reports too, that with the trauma-informed care, right? Like we have been working on becoming a trauma-informed agency over the past couple of years, which is easily a 5 to 10 year process to become a trauma-informed care agency. It's a cultural shift and change. So it's a very long process, especially when you throw a pandemic in there. But we are heavily focused on trauma-informed care principles, and my behavioral health specialist, Taylor Davis, has been amazing in this area, has just really taken us above and beyond in the trauma-informed care world. But trauma-informed care principle number 6 is on cultural humility and diversity and equity and inclusiveness. And so we actually have a trauma-informed care subcommittee that is newer and is dedicated just to looking at that. And so that trauma-informed care subcommittee is called Promoting Diversity, Equity, and Inclusiveness. In health promotion, the new health promotion coordinator is the leader on that committee, and then Taylor and I participate in it. And so we are, and the other thing I will say, like we're also, with Taylor Davis, the behavioral health specialist, we're looking more at promoting different things. So for example, December 3rd is World Developmental Disability Awareness Day. And so we are promoting that, and we are saying, remember, trauma-informed care, number 6 principle is cultural diversity, humility. So we are definitely doing work in that area.
Member Tello?
You know, I'm so happy that, because we've talked about the county and the health department being role models and leaders in becoming trauma-informed entities so that they can, so then hopefully other businesses, organizations will want to become trauma-informed. But I'm hoping that as you are rolling this out within our organization and within the county, that you're also like trying to kind of think about creating an implementation manual, you know, like if you're like keeping track of what all the pieces and steps are, so that you then could also help train other entities and organizations. And I know like SAMHSA and other, you know, statewide national organizations have some guidelines for how to do this, but I just think that we need to also be thinking, while we're doing it for ourselves, how can we also help other entities in our county do the same thing? So I guess I would just ask that you, as you know, are doing it, be capturing how you can also have a blueprint to help others.
So we are definitely, especially with Taylor being on board now, we do have track of some historical data over the past couple of years in our process. It's definitely not like a nice, neat blueprint, but, and we have pulled from tons of resources on different toolkits on how to become trauma informed, and we continue to do that. But especially we have our logic model that was included in the packet that helps us keep track of it. And the environmental scan is that baseline of data to show where we were at that point. And then that will be done again in 3 years to show, you know, what progress we've made and where we need to continue to make progress. And just real quickly, I have done some collaboration in helping kind of like support a different agency and what we've done, and they've shared what they've done. So it's been a nice collaboration to have that community support. And the other thing too is like, there is no like, it's pulling all these pieces together to do this is fairly new. And so it is just kind of like navigating it and seeing what works and seeing what doesn't work. And so we've been careful of not kind of like advertising too much at this point, because we definitely do not feel like we're at that ability to quite do that. But yep, we're keeping track of things.
Any other questions of Amy? Did you have anything else, Jessica, that you wanted to highlight? Yeah.
So just highlighting the other programs statistics again for September and October. If there's any questions about that. Also in my report is the updated work plan for the contact tracing grant. So have had those conversations with Illinois Department of Public Health about our hiring benchmark. So the initial number that I put in my report was 124 contact tracers was the number based on the Massachusetts formula. And we're working to get up to 55 by the end of this year. And that's really the extent of the grant funding that we have, is to support 55. And IDPH, we are also including the information, like I included in my report, of contact tracers that are the student workers at ISU. So those are going to be included in the total number. So the total number of individuals that'll have access to Salesforce, which is the program, is what they're actually going to be looking at. So not just contact tracers that we have on board. And so again, looking at getting all of the pieces in place, hoping to have 55 by the end of this year will definitely be very helpful to us. And then final report also included in here of the rural testing sites. So we have completed those at this time. I did include also in here information about antigen tests. So we did receive some antigen tests from Illinois Department of Public Health, which we're distributing to community partners. And we so far have received over 6,000 tests and distributed about 4,000. So they were coming on a weekly basis, and they'll hopefully continue to come to us as long as they're available to the state as well. So as we, yep.
Go ahead,
Jeff-
member. No, wait.
Oh,
Judy's
sorry.
first. That's all right. Judy's first.
Sorry.
Jessica, thank you. Your contract tracing grant report is excellent. I mean, there are just so many metrics in there. And I know that, I hope that it is picked up by various media sources because there's a tremendous amount of work in progress and things that have been happening. So just thank you for putting that together. I did have a question about the call center. If you could update us on where we are with that and how that's going. I know we had posted some positions, so.
Yeah, posted positions and we have held interviews. So the plan at the moment is hopefully to secure some space, and we're awaiting technology for those individuals that'll be working, and hopefully be able to get the call center operational by the end of this month or early December. With the holidays, that it does limit some of the bringing on and training of individuals. So hopefully by the end of this month or early December, we'll be able to have that up and running.
Member Tello, yeah, I think you're next.
Thank you. I just had a question about the rural testing sites. Like, do we know approximately how long it's taking the people tested in those to get the response back, whether they are positive or negative? Do we know that?
Sure. So for the testing sites that we were facilitating, it was probably on average 3 to 5 days. So it was pretty quick turnaround really for us.
Jessica, can I add to that? It was
talking.
This is Kathy. Sometimes it was much quicker than that too. We had 2 of our employees who were really tracking those test results, and sometimes they came back as quick as, the testing was on Thursday and the results would be back by Friday or Saturday. And our people called people right away as soon as they got those results. So usually it was pretty good, not always, but usually.
Thank you, Kathy. Member Schaefer, you had a question.
I do. I want to go back to the contact tracing numbers. And you had mentioned 124, and we currently have 34.
Yes.
Correct. And then, and the plan is to have 55. And that does not include, that 55 does not include the ones on staff that are able to do surge, which
Correct.
is like another 17 or something like that. Okay. I'm writing these numbers down.
I know, yeah. And then around 40 student workers that will be regularly on staff at ISU. And then it's hard to kind of get a number of the nursing students because they will be kind of in and out. So we're going to get pretty close to the 124 number. And again, in the conversations with Illinois Department of Public Health, we've been very open and honest, as all of our other state partners have been as well, across the, all the counties, about the difficulties that we have of hiring that many individuals. We have about, I think, 84, 85 staff at the health department. And so 124 contact tracers, that's a lot, but we're going to do everything we can to get as many people as we can.
Okay, so you said that the grant was allowed us to have 55. Does that count the 40 of ISU?
No.
So how are they getting paid? Or are they just because they're students, they're not getting paid?
Well, they're not paid through us or our grant. So they're actually working just through ISU. So they're not also doing community cases as well. They're just focusing on ISU students.
Okay, so IDPH's number includes the ones for ISU and Wesleyan and all those colleges that would not necessarily be ones doing community tracing, or is the IDPH number only for community tracing and then additional for ISU?
So their number that they gave was 124. And so then we've had several calls where we're negotiating, for a better word, of this is what we can do, this is how many we can get to, this is how many, and they want to know about how many ISU has, how many individuals we have that have access to Salesforce that can be used as surge capacity. So they are understanding that to get to that 124 total, it's going to be a hodgepodge of the grant funded and then people who work for the university and then our staff as well. So that all that together has been reported to them.
Okay, and then for that 55 that you want by the end of the year, the space requirements and the IT stuff, that is all being taken care of and all this other stuff that we're doing so that you will have the space for all of those people. You won't have to be going to looking for more space or anything like that.
Nope, yeah, it's definitely what we've been working on the last couple of weeks is getting technology in space.
Okay, so you're comfortable with the amount of dollars that we've received, or are we looking at possibly using some of the reserves that we have? Is there going to be enough from the grant to cover all of this to, you know?
Yes, to cover what we have anticipated. So what we've written into the grant and what we are planning is covered by that grant. The 55 and the space for them and the technology for them.
Okay, thank you.
Anyone else? And of course, you guys know the nursing students are working for free. Just so that you know. Those are faculty, no, who get paid, but not through the grant. Anybody else have any questions about her packet? Yes, ma'am. Hannah, Member Eisner.
Okay. No, I just wanted to thank you, Jessica, for the communication plan. I know I had last meeting had asked about that. So it looks like things are well underway for billboards and PSAs and other things. I would tell you that the links didn't work in my packet. So if you could send us something, 'cause it was great to have, and I was all excited, and it didn't go there. So be nice to have that. But I see that that's just about to launch or has about now with some delays.
Yeah,
I don't know if
our PSA is running and billboards should be up. And special thanks to Kim Anderson and the PIO team, public information team. They've been, doing that in addition to their normal day-to-day duties and doing a wonderful job. So thank you for all that hard work.
Yes, make sure we get the links because some of the stuff is really quite cute. I got a sneak peek, so. Anybody else have any questions? Concerns? All right, thank you so much. Really appreciate it. Where's my agenda? All right, so now we're going to move on to our action items. That's our next, Amy. So the first agenda item is approval of behavioral health 553 fiscal year 21 funding. Ms. Eisner, Member Eisner.
Thank you, Ms. Pohl, President Pohl. I'd refer everybody to page 79 of your packet. If you can get to that, there's a nice table there that shows all the requests that we've received for funding for this 2021. And then the second column is the recommendation from the committee. So you'll see the request far exceeded the available funds. And the other thing that I will report on is at this point, we discovered after we'd met and made our recommendations that we were looking at the budget a little bit wrong, and that there is actually $50,000 more available to make awards to our applicants. I won't go into the explanation for it, but I've talked to a number of people about it. So what I would do tonight is I would make a motion to approve funding as shown in the packet on column 2, page 79, which is for 1.143, 623.
623, that's correct.
1.143,623, and that we will meet again in our committee to to address how we would allocate the $50,000 that we have in addition to award. So with that, I'm going to go ahead and start things off by putting a motion on the floor, and then we can have discussion. Or Judy, is there something you wanted to talk about prior to that?
Okay, it doesn't require a second, so it doesn't, no, you don't need a second.
Okay.
It's coming from a committee. Did you
Okay.
want to say something, Judy, or no?
So if you have a motion and a second, any discussion or questions on that?
So go ahead, Sonia, Maurice.
I was just going to add the point while we talk about 1.43. I don't want us to overlook the line below us that talks about the court services, because that is also funding coming through our budget, as I recall. So when we think about how much money we're really spending on this, I like to talk about 1.35 on this, because that's what's really coming through our system and going out to help people. Yes?
Yes.
Get our story straight.
Yeah, no, and that's a great point. And I think sometimes it gets, because we've done this so many years that we forget sometimes that this is out there. So
yeah, well, it's assumed that we're going to spend it, and I get that, but I also know that in that assumption, it's all to address this problem, and the money flowed through. So anyway, just my point.
Hang on just a second, Corey. And just so everyone knows, we're having the folks from Court Services give us a brief overview of their program in December, so that all of us are clear about just an informational thing, so everybody knows how their program works. All right, Member Tello, go ahead.
I am in agreement with the motion, but and I'm glad that we will have that, we can meet again to decide how to take that additional 50,000 and apply it to the proposals that we move forward. I do want to just add a caveat or us to think about in the planned, in the recommendations that are listed there on the table. We have money allocated for Ending the Silence, which is again a suicide prevention program, evidence-based, which which has had amazing impact on our community. It's been very, very important, and particularly for youth to give them tools to reach out if they are feeling suicidal or if they have a friend that's suicidal. It's been very powerful. We've had many testimonials and pre and post testing data. But I did notice in the quarterly reports that Amy provided to us, if you look at page 43 in our packet on the quarterly report about Ending the Silence, they indicated that they have not even been able to deliver the Ending the Silence presentations for a couple of quarters because of COVID and in the school situation. So I still want it to move forward because I believe it is vital. I also know they have spent time moving it so it can be delivered virtually, which is very important. But I just would like us to indicate that as we move forward with this, that we have some conversation with Project Oz to make sure that it can be viable with modifications that they've been working toward.
Okay.
And let me just say that, as we review the application, certainly the question of how some of these programs can be delivered in the world we live in now with COVID. I noted that as well, Corey, but I do know that in the application that was submitted to us to review, there was a lot of positive statements about how they could modify the program to still deliver it. So, yeah. The same question came up with some of the embedded schools programs, with schools not in session, how do you provide that work? And I think we just, at this point, are proceeding with the hope that they can continue to deliver using remote and virtual platforms, because these services are dearly needed. And Andrew, if you at some point want to understand what we're doing right now, because this is a program that's sort of a separate entity and it takes a while to understand where we're going, we can educate you. But these are monies that are budgeted specifically for mental health programs for the county. Thanks to a referendum that was in large part due to Member Buchanan's efforts many, many years ago to enable the county to levy an additional tax to provide mental health services.
All right, Member Reese, did you want to?
No.
Okay.
No, I'm just thinking.
Amy, oh.
Yes,
Amy?
yep, sorry. I did quickly just for advisement on me moving forward, especially Hannah, after you found that 50,000. So my understanding is if you guys approve the way that the funding was recommended, then my next steps would be reaching out to these agencies about the programs that were approved to be funded and the programs that were not approved to be funded. That's the correct thing that I'm supposed to do, is to reach out to these agencies and let them know. And I don't know how the 50,000 would then maybe later play into an approved program, or if I get these contracts out.
It would be a contract amendment, Amy.
Okay, so, well, the contracts won't be executed by December anyways. So I'll go ahead and move forward. If this is what you guys are approving, then I just want to make sure I'm good to move forward and letting them know. And so some of the programs, I can't remember if it was one or two of the programs, are funded less than what they requested. So if they are to ask for serving less because they are receiving less, can I get some direction on how to move forward on that also?
What I'd suggest at this point is that you can notify the agencies of what's been approved this evening. And then we will meet again. I think December 2nd is the date that our committee is going to meet. I didn't see the results of the doodle poll, but I assume so it's only less time than we believe that December can be here. So I would suggest that maybe you bring any concerns to our committee at that point. And we can then move forward from there. I mean, I assume that they will not say, we simply cannot do this program for less than what we originally proposed, and then, we have to deal with what happens at that point. But I don't think we know at this juncture how we will go with the 50,000, and maybe we decide not to add to anybody's award and hold it for some other kind of pilot or something. I'm just speaking off the top of my head. I don't know. So I think, there's just a couple weeks until we meet as a committee again. So that I think would be the easiest way to handle that right now without saying anything this evening about how we might proceed.
Okay, great. I just wanted to make sure my next steps were appropriate. And so thank you for that guidance.
Thank you.
Amy, I believe you have your timeline. You guys had the timeline that we lay out for this whole process, and I wouldn't think you would change from that amended timeline you did for that. Like the sequence of steps that happen in the timeline that relate to 553, the funding process.
I mean, as far as the timeline at this point, I haven't really. I mean, we are where we are, so I haven't really kept up. But just yes, and my next steps are just to look at outcomes, make sure that they're appropriate, get the contract or service agreement put together. I think Hannah wants that at the next Behavioral Health Policy and Funding Committee to maybe see the template of the contract. And so then getting that executed with Carla and their CEO. So I have enough time to do what I need to. It's just also as far as with the agencies, they have to follow through and execute what they need to do, especially with, Project Oz won't be funded for one of their programs moving forward. So I want to make sure I give them some time to be able to take their next steps too.
Excellent. Thank you, Amy. Anybody else have any questions? All right, if there aren't any more questions, we'll do a vote.
Allen Ginsberg,
Aye.
Andrew Held,
Aye.
Carla Pohl,
Aye.
Corey Tello,
Aye. Aye.
Hannah Eisner,
Aye.
Judy Buchanan,
Aye.
Richard Janetti,
Yes.
Robert Colhase,
Aye.
Scott Hume,
He said
Aye.
Oh, there you go.
Sonia Reese,
Aye.
Susan Schaefer.
Yes.
Motion carries. Thank you. Don't go anywhere. Our next agenda item is approval of $12,900 for a 0.5 mental health first aid trainer and mental health first aid manuals and training materials. And that was what Member Tello was talking about previously. Did you want to say, go ahead?
Yeah, unfortunately, there is kind of a misinterpretation of that because we're not paying for a trainer. We're paying for half of the trainer of trainers cost. So in other words, we are going to be helping pay, they're going to bring a training into the community to train trainers.
That's what you're saying. Okay.
And we're paying for half of the cost of that training. We're not paying for a position. We're paying for
Right,
half
okay.
the cost of the training. So it's kind of written, it's not written, so we maybe should fix the wording of that.
Okay, so what wording do you want to amend?
It should say approval of $12,900 to pay for, let's see, to pay for half the cost of a trainer of trainers training. And I realize that's complicated, but that is exactly what it is. It's a trainer of trainers training. And we're paying for half the cost of that.
Okay,
And then everything else is correct.
everything else is correct. Okay.
And it's
I'll
really,
second
although I should say it's training materials for participants. I mean, I guess it's not training materials for the trainers, it's training materials for the participants of the course. Of course, participants.
Do we need to be that?
No, but I just wanted to make sure that you understand that all of the money is not going into the trainers.
Right.
It's going into the
Materials
also-
for, right.
Yeah, right. And so, yeah. Okay.
Member Reese.
And I'll second that.
Okay. Any other questions or concerns? All right, we're ready for a vote.
Allen Ginsberg,
Aye.
Chairman, I could interrupt you for a second. I don't
Yes.
think we ever got a motion and a second on this. I think we went right into discussion without a motion. And so I think you should probably call for a motion before you call for the vote. I
Okay,
think that's right.
thank you, Mr. Spanos. Do I hear a motion?
I
Correct.
will make that motion. I think Sonia thought I made the motion as I explained
so
it,
too.
so I do request the approval of up to $12,900 to pay for half of the cost of a trainer of trainers training for training materials and participant materials.
That would have been easier. Okay, and then Sonia, you were seconding that? Is
I
that
still
correct?
second it, whatever.
All right, now we're ready for a vote. Thank you, Mr. Spanos.
Allen Ginsberg,
I vote aye on the trainers for training.
Andrew Held,
You said that 5 times real fast.
Carla Pohl,
Aye.
Corey Tello,
If we all had to take a drink every time we said the word training, we'd be in big trouble. I vote aye.
Hannah Eisner,
Yes, 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 yes.
Judy Buchanan,
Aye, and I like Corey's idea.
The thumbs up.
Richard Janetti,
Aye.
Robert Colhase,
Aye.
Scott Hume,
Aye.
There's just a delay.
Sonia Reese,
Aye.
and Susan Schaefer.
Yes.
Motion carries. Our next agenda item is approval of $4,000 to purchase advertising and marketing for the 211 services. Do I hear a motion?
So move.
Second,
Second.
Member Reese. Hannah, do you have you want to have discussion? Okay.
Just a brief question. I think that the county purchasing policy allows some expenditure purchases to be made. I think this is within Jessica's authority to just do this.
Well,
So
and
I'm kind of curious why we're bringing it to the board for a $4,000 expenditure.
well, it's, and that's a good question. Actually, this is more of a courtesy motion because the money that these two proposals will be drawing from is already in the budget. It is money from the behavioral health piece that was set aside both this current calendar year and next year. So it is in the budget. That line's been approved already. And in fact, so this is just more of a courtesy. I guess it was our way of making sure you knew how we were expending out. Because, for example, when we approved the funding of all the services at over $1 million, that $1 million was in our budget. Really, what we approved is kind of how we intended to spend it, and there's some similarities to this.
Right, but I think that we're required to actually approve expenditures above a certain amount. So in the funding, those grants are within that level, but there's certain things that can be done just to simplify. I mean, I don't mind proceeding with it. I was just wondering whether we needed to, and I guess for Jessica, for your sake, you may not want us to always approve every expenditure that's within that. And I understand what you're saying, Judy.
It's actually going to probably be higher. I think we had really thought it'd be probably closer to an $8,000 or $10,000 expenditure. This was just to kind of jumpstart it.
Corey, go ahead.
I just want to be very clear that the money for the mental health first aid and for this are monies that are coming out of our fund balance. I want to make sure that people understand that this is not money coming from the money allocated for 553. We did not take money away from 553 dollars to put into this. This is coming from our fund balance. So I just wanted to get that very clearly stated.
Thank you. Yes, Hannah.
And just so that, I mean, this gets wonky into the budget end of things, but that money is in the 553 if we call the mental health program in total, just as the staff salaries and all that are. So it was budgeted to be funded through use of fund balance, which gets transferred into that. So, yeah, I mean, it's not detracting from the grants and the payments for direct services, certainly.
Excellent. Thank you both for that clarification. Anybody else have a question or concern?
This is Bob.
Yes, sir.
First, I want to thank Hannah and the others who have worked on this analysis of the different expenditures. Fantastic, and I know there's a lot of work that goes into that. So I just want to get my kudos into you that really appreciate this drill down and analysis. On this current motion, you said it was seed money. It seems low for a program that we want to really excel. Can someone just talk about not the nitty gritty, but basically the goals and how much bang for the buck we're getting for this 4,000?
And it is low. We having just finished our round of meetings with folks on this program. We haven't been able to attach cost to all of them, so we do anticipate it's going to be more costly. 4,000 in the scheme of what I listed is not going to pay for that, but some of that will not be able to be purchased or arranged for a couple of months anyway.
Correct.
I just want to make sure Bob knows that that's what we're paying for. And you're right, it probably will exceed the 4,000 we're asking for at this moment, but it's paying for all those things Judy talked about at the beginning of the meeting. The yard signs, the electronic bulletin boards, the social media campaigns, the, what else am I leaving out? The, even in, addressing it through the behavioral health forum, all the point people we're going to have that get the electronic messaging from Constant Contact to put out into their websites, all of that. That's what it's paying for.
Well, it's gonna start paying for that, right? Correct. Yeah, it's not, if you added all those up once I can attach a cost to them, it's going to be in excess of 4,000. But we're not going to do it all right away.
That's fine. Hannah.
I guess the more I hear this, I don't see the necessity for, and I'm not comfortable with a motion that is pretty open-ended in terms of the expense. Normally, we would be approving a contract or something more concrete. And I appreciate what you're saying, Judy, in terms of it being there to let people know what the potential expenses are. But now I'm hearing, and I agree, it seems like the breadth of what we're doing would be far more costly. It would seem more appropriate if we get contracts for sign printing or things of that nature that we bring them back for approval. But I don't think we need to approve the expenditure of the $4,000, given that it is in the budget and that we are approval to move forward. And I would think we'd wait and see if we have larger expenditures for advertising of some sort, that you'd bring them back for specific approval.
Well, and I think, for example, the media campaign that was part of our COVID packet this evening, I would envision the way in which that's advancing, that this will parallel that, because many of these things are not going to have a high price tag, but collectively they will. There's going to be a lot of contracts. There are going to be purchase orders and things like that, of that nature.
I think we just wanted to make sure we could do some spending before the end of this fiscal, before the end of 20. And that's why we were trying to just be transparent about, there probably will be some as soon as possible before the end of the current fiscal year. So that's why, Hannah, we felt like we needed to talk about it. So we were being transparent. So, I mean, that's why we said this is the amount we probably would spend initially.
Well, and I appreciate that. I just don't think that if we spend it, we do, and that'll be great. And to the extent we have contracts, something under contract, say for signs that might not be delivered till the beginning of the next fiscal year, we can still apply that cost to this fiscal year. But I don't think that this would save $4,000 for expenditure into the next year, if that makes any sense. But I mean, I'm completely in agreement with what you want to do, and I understand what you're talking about. I just think that this is not necessary to approve $4,000, and it doesn't really specify what that will go to in a more detailed sense other than just the general statement. So I'm just not comfortable. I'm comfortable with you spending the money. I don't think that we need to make this kind of a motion and approve it in that manner.
Susan.
I can
wait. Okay, hang on, Judy. Susan.
On the agenda.
Go ahead, Susan.
I agree with Hannah that this money has been budgeted and it's to be spent, and you just turn in your receipts for this. We've already agreed that I understand the transparency issue and things like that, but I don't think that we need to approve this because we've already given the approval to move forward the marketing thing. So I guess I agree with Hannah that this is kind of unnecessary.
Well, and as I said, it was probably more of a courtesy effort, but if we can, and perhaps Chris can help us with this, it's listed as an action item, but I'd be fine with withdrawing my motion. And I've heard, I think we understand the will of the board at this point.
And Samantha said that that's the way we should probably go. If the board wants to do that, we can either vote on it the way it is, or we withdraw the motion.
I withdraw the motion.
All right. Then our next action item, and by not voting on that Samantha has said that doesn't impact Jessica's ability to spend the money, just so that you know. I'm just telling you.
Jessica and I will.
Huh? All right. Approval of the next action item is approval of lease agreement with court for office furniture required for the COVID-19 contact tracers. Yes, Susan. I don't
I'll make that motion.
Thank you. Is there a second? Okay, Sonia, is there any discussion or questions? The contract's in your packet.
Mm-hmm. Yep.
All right, so we move to a vote. Amy, call the roll.
Allen Ginsberg,
Aye.
Andrew Held,
Aye.
Carla Pohl,
Aye.
Corey Tello,
Aye.
Hannah Eisner,
Aye.
Judy Buchanan,
Aye.
Richard Janetti,
Aye.
Robert Colhase,
Aye.
Scott Hume,
Aye.
Sonia Reese,
Aye.
Susan Schaefer.
Yes.
Motion carries. Our next agenda item is approval request for a memorandum of understanding between the McLean County Board of Health and the County of McLean regarding additional space required to house COVID-19 contact tracers. Do I hear a motion?
Move approval.
Thank you. Second, Member Reese. Any questions of Jessica? We just need more space. Okay, we're moved to the vote.
Allen Ginsberg,
Aye.
Andrew Held,
Aye.
Carla Pohl,
Aye.
Corey Tello,
Aye.
Hannah Eisner,
Aye.
Judy Buchanan,
Aye.
Richard Janetti,
Aye.
Robert Colhase,
Aye.
Scott Hume,
Aye.
Sonia Reese,
Aye.
Susan Schaefer.
Yes.
Motion carries. Our last agenda item is approval of amendment to the intergovernmental agreement between the Illinois Department of Central Management Services and McLean County Health Department for obtaining and administering influenza vaccine. Do I hear a motion?
So moved.
Thank you, Member Reese. Second, thank you, Member Tello. Any questions about this? Yes, ma'am. Ms. Schaefer.
Yeah, I have a question, and I don't know who it's going to go to, but I remember reading that the health departments are the point people for the state to distribute, to do this mass vaccination thing when we get the vaccine. But then I've read things about CVS and Walgreens are going to have vaccines too. So do you have a relationship with that distribution, or is that a totally separate distribution? And keeping track of 2 vaccine shots, with different providers and that kind of thing. And I don't know if you've got any of this information or not yet, but.
Yeah, there's a lot of it that we don't have, but we've definitely been reaching out to all of our community partners that potentially would be offering a vaccination, just to find out. We'll have the closed pods and the open pods that I referenced in my report, but then for those open pods, who out there is going to be helping that charge of vaccinating the entire population. So, trying to think what the other question was, Susan?
She just wants to know about CVS and Walgreens.
Yes,
CVS
so there
and
will be
Walgreens.
multiple different, besides CVS, Walgreens, and other pharmacies that will receive it, healthcare providers will as well. So it'll be available multiple locations, not just the health department, but we're really organizing and leading that charge.
The biggest problem that we're going to run up against with the two that are coming out first is the necessity to have a special freezer to keep it frozen. Super frozen, not just frozen like in your freezer.
And we're looking at 2 vaccines right now. We could have 4 different types of vaccines. So there's a lot of complications and things that we've been looking at in planning for this.
So you're just coordinating. It's not all going to just come through the health department and then go out to like CVS and Walgreens and medical, doctors' offices and whatnot. It's not going that way. They'll get it directly. Is that what you're saying?
Some will, yes. So some will get direct, but then yes, there will be some that comes through us and then is distributed to those partners. So it'll be multi-pronged.
Now, the motion is for the influenza vaccine. Just so we're all clear, this is not COVID, this is influenza. Yes, Scott, Member Hume?
Would it be possible this year to lower the cost of the flu vaccine for people that don't have insurance?
Is that a cost that we set annually in a fee?
I do not know that
I'll have to
answer.
check
I don't remember.
We will check into that. It might be in even 2021's.
Yeah, I can't. It's Tammy does that, right? She does immunization.
She does, but we set our fees annually.
Right. Okay. I said no, she knew that we had a fee for that. Okay, we're gonna check into that because
when we set and
because some of those fees are set annually and set in advance. Is there any other questions or discussion about the motion? And again, this is influenza vaccine, flu vaccine, not COVID. Praise God. All right, Amy, please.
Allen Ginsberg,
Aye.
Andrew Held,
Aye.
Carla Pohl,
Aye.
Corey Tello,
Aye.
Hannah Eisner,
Aye.
Judy Buchanan,
Aye.
Richard Janetti,
Aye.
Robert Kohlhees,
Aye.
Scott Hume,
Aye.
Sonia Reese,
Aye.
Susan Schaefer.
Yes.
All right, motion carries. Is there any other business for the good of the order? Yes, ma'am. Member Tello.
I just want to say again to the amazing work that's being done by the health department in all aspects of COVID, from all the contact tracing to all the gathering information to get out to the community to supporting the different entities in how they can keep themselves safe to the compliance monitoring, on and on and on it goes. So several of us have mentioned that, but we can't say it enough. We thank you so much, all of you who are part of that. And I know almost every department has had a hand in helping out. So I very much appreciate that all hands on deck approach and the very positive attitude and passion that this has been continuing for such a long time. Thank you so, so much.
Member Buchanan.
Yeah, very quickly, just to let the board members know that we have had 3 packages and treats distributed to our staff from the Board of Health, and acknowledging really what Corey's been saying, the exceptional effort put forward. We've had some really good feedback. I think, we not only said we appreciate you, but we provided some stress relieving things they could kind of play with or hang on to, and lots of good food. And several of you on the board have helped us get it ready. So we have one more to go this year, and I'll be in contact with you about that one.
Tammy, go ahead. Hang on just a second, Sonia. Go ahead, Tammy.
To make sure to let you all know, thank you for the thank yous. We kind of make a joke about that whenever we get the special deliveries, like, oh, we need to thank the Board of Health for the thank you. So we do appreciate it. And, you know, we have many days where we feel like we've really gotten the snot beat out of us. So things like that are good. So thank you.
And in fact, yeah, you're welcome, Tammy. The contract tracers have been in the building when we provided those treats too, and they just are so excited. And also we're very grateful. Where'd this come from? You know, who's the Board of Health? So I think people notice and have appreciated.
Yeah, thank you for your work on getting this organized, Jude. I appreciate it. Sonia, go ahead.
I was just going to say, one of my friends is a contact tracer, and she contacted me and said, wow, we had fruit in the little lounge area, and it was so nice to have that, and we really appreciate that the board got that for us. So she was recognizing what was going on. They're kind of new in this world and trying to figure out who they are and how they fit, and things like that really helped. Thank you.
Yes. Anyone else? Do I hear a motion? You guys did an excellent job again tonight, as usual. I'm sorry, Dr. Ginsburg. Go ahead.
I brought this point up to Jessica a few weeks ago, and I appreciate that she has somewhat changed the wording of the daily COVID reports, but I want you all to understand the severity of what we are going through right now. I think that the reports to some degree underestimate what is actually going on. The problem is that the reports really reflect only what's happening to McLean County residents, but our hospitals serve not only McLean County, we serve Woodford County, we serve DeWitt County, Logan County, we've served Ford County, Livingston County, and several other counties, and we are getting hammered. Currently, like as of today, I saw in the daily COVID report that there were about 20 or 22 patients hospitalized, McLean County residents hospitalized in the hospitals in Bloomington. That is about half of what's actually, of the number of COVID patients actually in the hospitals, because I know for a fact that there are 21 currently at Broman alone. I also know for a fact that I have 3 COVID patients in the ICU at this time, 2 of whom are on ventilators. So the numbers that you're seeing, I mean, the case numbers are fine. I mean, those are important. But the part of what we have to keep in mind is hospital capacity and the capacity of staffing in addition. We have right now, as of last night at Broman, we had every ICU room filled. And we only have actually, of the 12 ICU rooms at Broman, we have a capacity, we only have 5 rooms that are considered adaptable to keeping COVID patients. So when all of those 5 are filled, then we're starting to take risks amongst ourselves. We've had one nurse who's already COVID positive. Our group is even talking about what happens if and when, because I'll be amazed if one of us does not get COVID by the end of the year. What is, how we have to adjust and adapt to that. my outpatient practice has gone to, from earlier in the summer, we were up to about 80% of seeing patients in the office. Now we're down to about 20% of seeing patients in the office. So this is I cannot stress enough the importance of getting that message out, that this is much more serious, because I see it on social media all the time that, oh, we don't have a big problem here. We have plenty of hospital capacity. Not many people are getting sick. Lately, it's been a little more hitting closer to home, as every day there seems to be more people dying. I will also say that right now the statistics are such that if you're on a ventilator with COVID, you have about a 20% survival rate. So I hate to end the meeting with such a dim message, but this is what happens after 3 days dealing with this in the ICU. And I really think that it needs to get out there, that this is we're not just trying to get people to mask. We're trying to get people to protect themselves and everybody else. Because I just, after seeing the Facebook video of supposedly this past weekend, I was appalled, absolutely appalled. And I've come to the conclusion that I don't think there's anything that any government entity can really do. I mean, we can try and try and try, but people are going to do what they're going to do. And even in New York, I just heard on the news yesterday, in New York, they want to restrict Thanksgiving celebrations to 6 people, but they've kind of decided there's no way to enforce that, because how can you enforce what's happening in somebody's house? You can't send the police there when there are many cars parked in front. But this is just something that, from somebody who's working there on the front lines, it is, I very much am involved in, and it's very depressing. I've got nurses every day. One of the nurses starts crying because they're so frustrated with everything that's going on. So anyway, thought I'd add my happy piece to this.
Thank you for saying that, though, Dr. Ginsburg. I think that's something that, everyone in the community needs to realize, that things are pretty serious at both of the hospitals. And the only way that we're going to survive this, because we're not going to have mass vaccinations until April or May, is that we all need to be wearing a mask anytime that we're outside of our house.
And Dr. Ginsburg, thank you for your service, really, because you really are in your position. You are in the eye of the storm.
Yeah, so Dr. Janetti, Alan's 100% correct. We talked about this morning about the daily updates and how it, although accurate, kind of misleads the hospital capacity. We're seeing people from Iowa, because Quad Cities are full. Our system seeing people from Iowa because they have no beds. That's pushing people further east in our system. So I think that anything we can do to really accurately portray what's going on in our hospitals, because we, taking people from Woodford, from DeWitt County, from Livingston County, and so does Carl, right? And so I think that a lot of our people are not necessarily from McLean County, they're in our hospitals, because some of these smaller institutions cannot take care of these folks.
Go ahead, Andrew.
Dr. Ginsburg, just a question on, because my mother-in-law is a nurse, some of our volunteers are nurses. Is there a growing need for, I don't know where they're at with chaplains in this sense, but is there a need for, whether it's spiritual guidance or, hey, just other adults who can take the time to listen, to encourage those of you on the front lines. Is there a need for that? As you know, I'm a licensed pastor and connected with a lot of the other churches here in the community. And certainly if there's a need, that we could definitely rally some adults that could at least come encourage and uplift somehow as you guys deal and struggle with some of these issues.
It's to some degree, that's a logistics problem, because I mean, we've got chaplains galore in the hospital there, but they're there for the patients and the patients' families. And we're very obviously now we're cracking down and limiting visitors again and patients' families. But they've been very, very involved. At the same time, it's the mindset of most of the healthcare workers in the hospital. We're kind of in a siege mentality, and everybody just kind of goes to work, tries to get through their day and get done and out. And it's I think, you know, the mental health issues that are occurring in the hospital are not to be dealt with lightly. I don't know offhand what the answer is. I think that the systems, both OSF and Carl now, are kind of trying to address it, but they're not. It's really difficult to address. And because at the same time that you need to address that, you need boots on the ground. You need people working. And right now, for example, from a nursing standpoint, there are no agency nurses available. There are no travel nurses available. I mean, the stress on the system across the United States is so great that it's impossible to find help. And we have, you know, the administrators and the charge nurses spend half their day trying to make sure that there's going to be enough nurses on the next shift, you know, just to get into the next shift to take care of the patients.
Yeah, I definitely understand that. Well, if you can think of any things that we can do, because youth leaders across the nation are struggling with the same thing. As we're trying to help teens, our youth leaders are burning out and falling out, and so we don't want that to happen to men and women like you and in your field. So even if it's not a visit, if it's I don't know, if there's things that we can do as a community, if it's obviously we're not cutting grass right now, but if it's shoveling snow or just anything to just kind of keep you guys just uplifted and just focused, please reach out, and we can definitely use our contacts to kind of help to keep you guys uplifted as well through the process.
Well, I do thank you for that.
I wonder if you could organize something like what they did in New York City, where the community stands outside the hospital and applauds staff as they come and go. Sonia, go ahead.
I believe I saw a listing from the state that identified what their expectations were for people coming into the hospital. And if two people happen to be allowed, it could not be two family and a clergy. It needed to be, they needed to replace one of them. So there's some fairly clear expectations that have come out of Springfield about how many could and should be in those settings. So I'll try to find that. I just saw it in the last 24 hours. And if I can find it, I'll get it off to you, Andrew.
Okay. Anyone else? Thank you again, Dr. Ginsberg. I really appreciate your service and you bringing that to our attention. All right. Do I hear a motion to adjourn? Sonia? All right. You guys have a safe Thanksgiving. Remember that the caution about traveling and your commute and your family gatherings. We'll see you guys in December.
Thanks, Carol. Good night.